Will biomarkers for Alzheimer's disease be a good tool for life planning? No. What is Alzheimer's and how does it affect the body? Alzheimer's is a progressive disorder that causes the brain cells to degenerate and die. It is one of the most common causes of dementia. It focuses on reducing the person's ability to think, behave, and reduces their social skills. It also disrupts a person's ability to function independently. Who are at risk of having Alzheimer's? Older age men and women, age 65 and over, people with a family history, many people with Down syndrome, men are more likely than women, people with underlying memory problems and heart conditions, people with past head trauma, people with a poor sleep pattern, people's lifestyle, example, obesity, smoking, and diabetes. What are biomarkers? Biomarkers are a group of atoms bonded together that show a normal or abnormal procedure taking place in your body and could be a sign of an underlying condition or disease in the body. Biomarkers have been used for many years for detection of disease. Alzheimer's have been present for over 100 years. That's why people are dependent on biomarkers. Biomarkers is seen as important to many because it helps detect disease and is more visible. But there are medications that slow down the progress of the disease before the stages occur. Questions and issues with biomarkers. Is there a cure for Alzheimer's? Alzheimer's has no cure, but treatment for symptoms are available and research is still in process. Why are biomarkers expensive if its use is for detecting if I have the disease? Biomarkers are very expensive. They range from $5,000 and over, and they are not reliable. They could be a waste of time for the doctor and for the patient, and the diagnosis might not come out right. If there are medications, why am I going through the use of a biomarker? There are medications. These medications are prescribed with the hope of slowing down the progression of the disease. There are also medications for any underlying condition that is already present. These medications can help reduce pain and discomfort in the body. How accurate or reliable is the result from the biomarkers? They are not accurate or reliable. Why are doctors and patients still using biomarkers? Most biomarkers are really awful, even though doctors depend on them. Most do not reflect how the patient is feeling or whether their condition is moving or improving or worsening. If the biomarkers look good, the patient must be doing good too. And conversely, if the biomarkers doesn't look great, the patient must be doing poorly. Therefore, there's no need to ask the patient how he or she is doing. The biomarkers has a higher priority than the patient-physician interaction. Most times, the entire process doesn't even need a physician. Alzheimer's is not a preventable disease. Therefore, the use of a biomarkers for a disease that's not preventable is basically a waste of time. Based on Aristotle's ethics, the single moral standard is not just human welfare, but our welfare. It is important that people are as happy as possible. We want to be happy even though there's some type of sickness moving around in our body. There are several factors associated with leading a healthy and happy lifestyle, and these might play a role in reducing your risk of having Alzheimer's disease. These are, but not limited to, avoiding smoking, control the already underlying risk factor, example, diabetes, high blood pressure. Eat a healthy diet that's rich in vegetables, fruits, and lean protein. Be physically and socially active, engaging in aerobic activities. Be vigilant of your mental health. Make use of cognitive skills and memory skills. Example, playing memory games and puzzles.